Hi guys, I decided to spend a few minutes and talk to you about HPV vaccination and cancer prevention. And the reason is simple. Everybody wants to prevent cancer. Who doesn't, right? I was basically cornered a few months ago by one of my patients asking, shall she vaccinate her child or not? And did I vaccinate my child? The answer was no. So why I did not vaccinate? And here is my answer to my patient and other people who are interested to know why I did not vaccinate. About 10% of women, and by the way, this is from CDC website, women will develop high-risk HPV. High risk means HPV 16 and 18 on their cervix will develop long-lasting HPV infections that put them at risk for cervical cancer. Put them at risk does not mean that they will have a cervical cancer. Read every word very carefully. Similarly could be said about vulvar, vaginal, cancer of penis, anal area, and oropharynx. It can cause cell changes called precancerous. Precancerous does not mean cancer at all. On the next page, you will read that HPV vaccine has not been shown to prevent precancers or cancers in other areas of the body, such as penis or oropharynx. So if we go back here, we will eliminate oropharynx, we will eliminate penis, and we will left with cervical, vulvar, vaginal, and anal cancers. And by the way, I want to stress your attention. When you will look on CDC website, you will never find a statement that will say HPV vaccine will prevent cervical cancer 100%. It may say something like that on insert for Gardasil vaccine, but not for on the CDC website. It will say HPV vaccination can prevent. Can does not mean will. An estimated 28,500 new cancers per year, and I will talk about that 28,000 a little bit later. But now I want to stress attention on word can. Does not correlate with will. And here is explanation why not. When Gardasil hit the road in 2006, it was under investigation for about 7.2 years. In 2006, we started to vaccinate 11 and 12 years old boys and girls. Cervarix get on the market 2009 and Gardasil 9 in 2014. Right now it's 2017. The kids who were vaccinated in 2006 are now 22 years old. So these boys and girls were 11 and now they are 22. Very important number. Pay attention to that because the median age of cervical cancer diagnosis is about 49. So if they are 22 years old now, they are not 49 yet. They have 27 years to go before we see in that population cervical cancer. And if we see reduction in cervical cancer in the population, we will vaccinated population, we will see it in 2044, 27 years from now. Okay, that's where we'll see big data really coming into our attention. Till then, we don't know. And I post this article from PLOS from 2009 saying the somatic mutation promotes cervical cancer progression. I will read, infection with HPV is not sufficient to cause cervical cancer because most infected females develop transient epithelial dysplasia, means precancer, that spontaneously regress. Progression to invasive cancer has been attributed to diverse host factors such as immune or hormonal status. So we physicians know for a long time that health of the host is extremely important. Okay, we just don't know if it's a hormonal status, immune, maybe all of that will contribute to conversion HPV to aggressive cancer. Thus, no current genetic alterations have been identified in cervical cancer till now we have that. And now LKB1 inactivation in primary tumors was associated with accelerated disease progression. It was shown that 20% of cervical cancer harbor somatically acquired, somatically means not associated with sperm or not associated with eggs, mutations in the LKB1 tumor suppression. LKB1 tumor suppression is a gene in our DNA that will suppress cervical cancer, and it was found in 20% of cervical cancers. Okay, and what happened then? When the median survival was only 13 months for patients with LKB1 deficient tumors. So if that basically means that if they have mutation in this gene, LKB1, they really had aggressive cervical cancer. Survival was only 13 months. Thus, the major cervical tumor suppressor, demonstrating that acquired genetic alterations drive progression of HPV-induced dysplasia to aggressive cancers. Okay, so that basically tells us that HPV infection by itself is not sufficient. It's only one ingredient among many that contributes to overall cancer. Okay, so HPV can regress by itself. HPV infection can regress. Okay, so now when you read on CDC website, you understand why they don't say straight that HPV vaccination will prevent 100% this cancer. It can, but we don't know if it will. We now know that different factors contribute to that. How they contribute, it's not clear yet, but we know that HPV 16 and 18 by themselves are not enough. Okay, so look at every advertisement very cautiously. So I put the slide for you here to show that HPV associated cancer did not even made into statistics of National Institute. I mean, they are there, but 10 the most common and the deadliest cancer. So this column, all cancers. This column is how many people will be diagnosed this year. It's basically morbidity column. Okay, this column is mortality, how many people will die this year for those cancers. For example, bladder, 79,000 will be diagnosed, 16,000 patients will die. Or look at the breast cancer, 252,000 will be diagnosed, 252,000 will be diagnosed and 40,000 will die. Okay, look at the lung cancer, 222,000 will be diagnosed and 155,000 will die. This is the killer number one so far, right? Look at the pancreatic cancer, 53 will be diagnosed, 43,000 will die. This is the most aggressive cancer. Okay, so not a lot of people will die, will be diagnosed, but almost all of them, survival rate is very low from pancreatic cancer. And look at morbidity and mortality cervical cancer. So cervical, 13,000 will be new cases this year and 4,000 will die. 8,000 of anal cancer will be diagnosed and 1,000 will die. Vulvar, about 6,000 will be diagnosed and 1,000 will die. And vaginal, not that common cancer, 5,000 will be diagnosed and only 1,000 people will die. So the total amount of diagnosed this year will come to about 31,000. So when I was talking about this slide and said 28,500 new cancers per year, so estimated, that's what they estimated in their year, and this is the new estimation, 31,000 will be diagnosed. Only this amount of people, this number of people will die. People often tell me, well, don't you want to prevent this cancer? I should. Sure, every person who died is counts, right? But are those are really deadly as cancer? No. Look at that deadly. Look at that lung cancer. 155,000 will die. Okay. Look at the, for example, colon cancer. 50,000 will die. This is a lot of those cancers are preventive. Some patients will have a genetic mutation, but a lot of that is just unhealthy eating. Okay, so there is a lot of room to work on different kinds of cancer. And if some people say, well, I am not sure that I want to vaccinate my child, so I feel it's very difficult to say that, oh, you have to vaccinate your child because the child will transmit HPV to some other child, and the child may die. So I am not sure that it's right way to go, because we don't know exactly if HPV vaccine prevent any cancers. We just don't know, and we will see the big numbers. Epidemiologists will report to us about cervical cancer in 2044, and look at, it's like, if we will substitute here cervical cancer with anal cancer, so the age of diagnosis, and we will put here roughly 60. Don't quote me, it's early 60s, but let's put 60 here, right? Does HPV vaccine prevent anal cancer? Those kids are 22 now. We will see results of prevention, HPV vaccine prevention cancer of anal cancer in roughly 2055. So I don't think it's fair to ask people to vaccinate their kids if their causes, it's not exactly clear if vaccine will prevent. And there are other cancers that we actually can work and prevent. Okay, so, but we will talk about that. It's a very good topic for discussion in 2044, because if we will see that the number of cervical cancer, this number will go down drastically, we'll say, yes, that's due to vaccination. Yes, let's vaccinate everybody. We can prevent 4,210 deaths of female from cervical cancer. We will vaccinate every kid. Well, I understand at this time that HPV vaccine is not free of side effect. So is it fair to sacrifice some other kids now to save this number? We will talk about in 2014 how many kids we are willing to sacrifice to cut down, to save this number of people. Okay, but for now it's all big question. If you decide to participate, I consider that if it's unknown, I don't participate. If you decide to participate, treat it as a research. Okay, so, and not everybody is willing to participate in research. Some people will say no. So anyway, talk to you guys about this topic in 2044. Bye for now. It's Dr. Veronica with crazy healthy ideas. Ask me questions here. Please comment. Let me know what you think. New information will be coming out. Stay healthy. Bye.